I was first diagnosed with multiple myeloma in 2016, and I was 39. So I was just completely devastated. I went through my first line of therapies, was injections and then a stem cell transplant. And afterwards, I was just in excruciating pain. And I was looking for something to support these treatments, something holistic. And I went to my first treatment, and I just remember leaving there and I was like weightless, like my body didn't feel in pain. My mind was at peace, and I knew I wanted more. So I was excited to continue on.
And one of the things that I've done the last couple of years since I've been on the board, Sandy will get donations through the computer, through the mail. I get to call people and thank them. And when you speak to the folks, you can feel that they gave it from their heart. And some folks were former participants or their family members or family members of those that had passed. And they share how much the services that we provided to them helped them get through the tough times.
I too, like my friend Laurel, came to NightSparks because of a cancer diagnosis. After my first session, the peace that came, the just ability to relax fully in the midst of terrifying trauma, basically. And so after about 4 sessions, I knew that I had to do this. I had to give back. I said, I'm going to live first. I'm getting through this. I'm going to get healthy, and I'm going to do this. And so I trained to be a healing touch, and I'm also a Reiki practitioner. And now I am a provider. And I also am currently part of the team that volunteers down at Denver Health in the infusion ward. We're working with people who are going through their infusions.
One of our hospital programs is at UC Health Anschutz Cancer Center. We offer sessions, have been there since 2017. Took a break during COVID, had to stop for, about a year, but then they were the first hospital to invite us back in. So we love these people, and we love the nurses. They're just amazing. Jennifer, tell us a little bit about your experience with our program at the Anschutz Cancer Center.
The days that we have, either Reiki folks or healing touch individuals that are volunteering their time, there's just a different sense of peace and serenity that I find in the infusion center. It just does help. Healing occurs in all kinds of different ways. You had asked if, to just share one of the interactions that I had. And it was caring for a patient who was in extreme pain. And that pain crisis was leading to a little bit of a panic attack and some anxiety. And one of the healing touch volunteers happened to be in the infusion center that day. And I caught one of the other nurses' attention who sent him over. And it was just a really touching, I think, an effective way that as I was taking vitals, as I was giving pain medicine, this person could provide healing touch. And again, just a great partnership between what I could do medically and what one of the practitioners could do through healing touch. And eventually just watch the calmness come over the patient as we worked together to be able to help get his pain under control.
It's been quite a couple of years, and last year was quite a difficult year for us, actually. It was very challenging because all of our expenses came back to pre-pandemic times, but the donations didn't come back because there's so much uncertainty and people don't know what's happening. And so if you look at this graph, you can see this is for 10 years, and you can see how we've been growing. There's 2019, we were at about almost 500 people we were serving, and boom, then COVID happened. Then we started to come back. We started to get invited back into the hospitals. We started serving more people, but then last year, like I said, was a pretty challenging year. And the reason I point this out is because the financial piece really does impact the numbers served. And you can see it right there on the graph. When we don't raise as much money, we just don't have the resources to serve as many people. This is the time. We have big goals for this year. I mean, I really think that we can serve 500 people this year. We're going into another hospital. We have physical locations. We're just coming out of total remote sessions into remote and in-person sessions. We're poised to serve a lot of people and to really make this happen for a whole lot of people that need this service. And, but it is dependent upon the funds.
We know that cancer patients experience tremendous relief following their Reiki and their healing touch therapies. And your donations will lower the pain. They will lower the stress, and they will increase the positive impact, the positive spark, that life spark that we can add to the lives of the brave people that have to overcome cancer. We can only do this work with your support. You can make a difference right here, right now.
Well, I mean, I just feel like we're a community. I mean, none of us does this by ourselves. It takes all of us. It really is a community effort. It's like a family. And, we all do this together. We do this because we have open hearts, because we have compassion, because we've seen the difference it makes.
Do open up your hearts and help us with any donation you can. Every bit counts. From my heart, thank you.